All right, guys, let's get busy talking about our isolating developmental disorders. I usually like to scaffold these as the disorders that are going to make children feel ostracized or not accepted. We're going to start out by talking about separation anxiety disorder. And I really suffered from this as a young boy, so it hits really close to home. I'm going to use my personal story to describe it. This is an intense fear of being separated from either your home or your caretaker, such as your mother, your father, or your provider. Now, when I was young, I had an extreme attachment to my mother, and I would get extremely upset and I would be super sad. I would cry whenever I had to be pulled away from her to go to school. Now, this is important that it manifests around the beginning of school years because it is only considered pathologic at older than 4 years old. So, when you're younger than four, it is normal for you to feel distress and sadness when you're separated from your mother or your father. However, when you progress beyond 4 years old, it is normal for you to start becoming comfortable with having some alone time. I, however, was not comfortable with this at all. Up until the third grade, I would cry on the first day of school. I would get extremely upset when my mom would leave, and I would find any way I could to be attached to my mom. So I would oftentimes fake being sick, or I would pretend like I went to the bathroom in my pants. Anything I could do to get close to my mom, I would do. So usually we will see patients with excuses to avoid this separation. And a great example is pretending to be sick. The treatment here is going to be cognitive behavioral therapy, play therapy, and family therapy. And usually kids will outgrow this as they grow older. Now, let's move on to talk about Tourette's syndrome, which is another condition that makes children feel really ostracized. This is going to present before 18 years old. And really, really important here, guys, is that symptoms have to persist for greater than 1 year. A lot of times, step one questions will ask about that 1 year threshold. They love to ask about it for some reason. I want you guys to be paying close attention to that. It is described as recurrent motor and vocal tics, which are when people like blurt out certain phrases or they might jerk their head in a certain direction or maybe blink their eyes or smack their lips. These are all examples of tics that people experience with Tourette syndrome. Additionally, they can have something called corporalalia, which is where their verbal tics tend to be offensive in nature. So these are going to be swear words or offensive language that they use as part of their tic process. It is important to know that these tics are all like subconscious. They are not within the control of the patient. So they just subconsciously do these verbal or motor tics, and it's not something that they consciously choose or control doing. This is associated with OCD and ADHD as well. And when we talk about treatment, this is probably the most high yield part of the whole discussion. And this is because treatment is only indicated when tics are distressing. So if you have a patient that's presenting as Tourette's and you think, wow, this person looks like they have recurrent motor and vocal tics, and these tics aren't really bothering their life. So they have friends, they function perfectly, they hold their job, they do well in school. No treatment is required. It is only when the tics start really interfering with like daily function and social relationships that we move on to treatment. And treatment is going to be tetrabenazine, antipsychotics, and alpha 2 agonists. These are all great options for patients suffering from Tourette syndrome. Lastly, let's move on to talk about gender dysphoria. So, normally, when we're growing up, we start to identify as a specific gender around age 3. And normally, we think of this as boy or girl. However, there is a whole spectrum of gender identity that we have come to accept. And patients may identify anywhere along this spectrum. When we start talking about gender dysphoria, it is where patients start having some non congruence with the gender they were assigned at birth. So, an example would be a person who was assigned male at birth and they start to feel that they do not identify as a male as they approach age 3, 4, 5, and 6. These feelings compound to get more and more intense as they enter puberty and they start to really identify with a specific gender. It's important to note that patients can identify as one or more genders and exist anywhere on a spectrum of genders between male or female, and this is completely normal and non pathologic. Additionally, it is important to note that not conforming to gender is not a pathology. It is not something that is wrong with someone. It is just a deviation from what was societally considered the norm. Now, when we move on to talking about transgender, this is where our patients are starting to pursue lifestyle changes to further identify as a gender of their choice. This may involve hormone replacement therapy or surgeries that help them further identify with the body they desire and the gender they desire to be. So that's a little recap of gender dysphoria and our isolating developmental disorders. I hope this helps you out on test day.